Good afternoon. This is Dr. Saujanya, pediatrician and neonatologist from Kamaneni Children's Hospital, LB Nagar. So today we will be discussing about the care of preterm babies or premature babies. So who are these premature preterm babies? Preterm infants are those born below 37 weeks of gestation or who are born less than 258 days. There are subgroups among them. So extremely preterm, early preterm, and late preterm. So extremely preterm are those who are born below 28 weeks, and early preterms are those who are born below 34 weeks. Late preterms are those who are born above 34 weeks but less than 37 weeks. So why do these preterm deliveries happen? Poor nutrition status in the mother, women who are younger than 16 years or more than 35 years, excessive maternal activity leading to physical stress, or long-standing maternal illness, if there is any multiple gestation like twins or triplets, any uterine or cervical abnormalities, and very rarely some genetic abnormalities in the baby. These all causes can lead to premature deliveries. What are the problems expected in a preterm delivery? Most problems that are associated with preterm delivery are because of immaturity of the organs. So respiratory wise, if we see, there are conditions like respiratory distress syndrome, where there is difficulty in breathing, or apnea, that is where there is stoppage of breath spells, and long-standing lung immaturity can also be seen. This is known as chronic lung disease. These lead to prolonged requirement of NICU care with ventilatory requirement and medications to help breathing better. Cardiovascular wise, they develop low blood pressure, high or low heart rates, low saturation, that is oxygen levels in the blood, and also some small holes or channels in the heart which remain open. Usually they close off post healthy term deliveries. Neurologically, these babies may not cry, leading to neurological problems later in life. So there may be bleeding in the brain, or oxygen might not reach to some parts of the brain, and there is immaturity in the brain, which can be irreversible, leading to difficult milestones in childhood. Like they might have difficulty in sitting, standing, or walking, and some mild intellectual problems. Blood-wise, they can develop low hemoglobin frequently, requiring frequent transfusions, and there may be altered bleeding and clotting capacities of the blood. There may be repeated and high levels of jaundice requiring treatments. Nutritionally, it is difficult to put them onto normal feeding. It is also difficult to initiate direct breastfeeds, especially if they are of 2 less weeks, and it is difficult for them to gain weight. They might require prolonged treatment with external supplements, and they might require prolonged nutritional support. They frequently land up in a condition called NEC, which is difficult to treat and might require surgery in late stages. Kidney problems like decreased or excessive urine output and salt imbalances can be seen. Their immunity is also low, leading to frequent and deadly infections. Their hearing may be affected. Their eyes may be affected due to prematurity or also due to prolonged NICU stay requiring multiple treatments. They cannot maintain temperature well on their own and require constant monitoring in NICU. So how and where do you plan for a delivery if you're suspect of any premature delivery in case? If it is told that a mother is at risk of preterm delivery by the gynecologist, it is better to plan the delivery in a center where there are facilities for level 3 NICU, meaning specialists with neonatologists with a team experienced in handling preterm deliveries, adequate staffed hospitals with ventilators, and availability of emergency drugs. It is difficult to transport such preterm babies to different centers once after they are born, as they might not be able to tolerate the stress of transport. So this is the major reason why you have to select a hospital which has all the equipment ready for to handle a preterm delivery. Secondly, they almost always require emergency treatments as soon as possible. If such babies are managed within 1 hour of birth and stabilized well, their outcomes are better. So something which we call as golden hour management. So what care is given at the time of delivery? The gynecologist and neonatologist will give you details as to what to expect in the delivery depending on the week of gestation. Late preterm babies, that is who are born beyond 34 weeks, do quite well with minimal monitoring and minimal observation. Some of them can be shifted to mother side with careful and frequent monitoring. But remember that they are at high risk of developing all the aforementioned consequences. Early preterm babies, that is babies who are around 32 to 34 weeks, early preterm babies require little support at the time of birth in getting their first breath, and almost all of them require NICU stay with some form of respiratory support and a treatment modality called surfactant therapy and others. Extremely preterm babies, like if the babies are born less than 32 weeks, are at highest risk of problems. So they require multiple qualified doctors and staff around during the delivery, as they may require highest resuscitation immediately after birth. So what kind of treatments are given to these babies at NICU? Oxygen support, non-invasive ventilation like CPAP or NIMV, or invasive ventilation with tube inside the breathing pipe, depending on the severity of the problem. Some medications like surfactant therapy are given, then stimulants which stimulate the breathing, and antibiotics according to indications, and intravenous fluids like glucose with or without any blood pressure medications may be needed. They may require procedures like long lines, lumbar punctures, and some basic scans they might be requiring. They also require prolonged administration of total parenteral nutrition, something where we give nutrition through IV cannulations. They require frequent monitoring of blood parameters and frequent screens for infections, along with regular screens for brain, abdomen through ultrasound and X-rays. They may also require advanced scans like 2D echo, MRI based on the condition of the babies. The stay of NICU is dependent on several factors like the gestation age, that is how old the baby, how much of weeks, risk factors in the mother, and risk factors present since birth or acquired later on in babies. Grossly, such babies can be considered for discharge if they reach at least 34 weeks of age, weaned off all the respiratory support, that is, there is no respiratory support requirement and no glucose infusions, and maintaining temperature without warmer, and accepting feeds at least by spoon, paladi, or bottle. And most importantly, discharge will be decided on the support system in place at home. If the babies are not having a proper support system at home, then they might find difficulty in growing up. So these babies also require high levels of patience and monitoring at home post discharge. What care to be given for the preterm babies at home? If you break into bullet points, firstly, feeding every second hourly in whatever manner the parents have been trained is to be given, and maintaining warm temperature of the babies, avoiding unnecessary contact to prevent infections. Kangaroo mother care, a process where mother or father holds the baby, is to be given for some time. And vaccination can be initiated once the baby crosses 1.8 to 2 kgs. Frequent follow-ups as advised by the pediatrician and neonatologist. So what are the chances of survival for preterm babies? If we see weeks wise, a 24 weeker has 60% chances of survival, and a 28 weeker has around 80 to 90% chances of survival, and 32 weeker has around 95 to 97% of survival. 34 weeker, there are very less chances of deaths, around 1%. So these statistics vary according to the problems and also the severity faced by them during and post delivery. It also depends on the duration of NICU stay, the level of care received, and post delivery. Hence, the importance of choosing centers where preterm deliveries are taken up. They also vary based on the social and family support and the willingness to give extra care and nurture that these tiny tots require. So how is the future for preterm babies? Many of them are apprehensive about neurological or mental retardation or physical disability. So definitely the most obvious effect would be on the weight and height of the child as well as in adulthood. Some very few of them may develop chronic respiratory breathing problems like chronic lung disease. Neurologically, they may develop handicaps like cerebral palsy, developmental delay, and cognitive disabilities like language disorders, learning impairment, hyperactivity, attention deficits, behavior abnormalities. But these are very, very rare. Very rarely, they might have hearing loss and visual problems too. So, what do I tell the parents who are expecting preterm? So, remember that the past 2 decades has seen a lot of technological and intellectual progress in the field of preterm care. So much so that we have been able to salvage the baddest of the cases and given a life without any disabilities whatsoever. So positive outlook towards the pregnancy and being well prepared with knowledge wise would go a long way. Have you seen, we have seen multitude of preterm deliveries for various reasons. We have been able to salvage most of them. The smallest of the tots being 27-weeker twins who were 700 to 750 grams. So ultimately, there is no reason to be scared or apprehensive of if some mother lands up in a premature delivery. It is we have seen a spike in the deliveries that are happening prematurely, most probably because we are landing up in conceiving issues and they landing up in requiring IVF or IUI. So when these things are happening, prematurity comes as a part of those treatments for conceiving. So we have enough progress in the field where we can allow the prematures to be born with and with adequate care. I think most of them can be got out.